Hi, my name is Janet Sartain. I am a senior nursing student at Indiana State University's LPN to BSN nursing program. These presentations are part of the clinical hours required for community health nursing. Today's topic is going to be if you're healthy and you know it, smile. How well does everybody know your mouth? If you'd stop for just a minute, take this short true-false quiz, and then we'll proceed. Learning objectives for this presentation. Following this presentation, the learner is going to understand what dental plaque is and how it forms, be able to list the foods, drinks that cause tooth decay, understand the consequences of tooth decay, should also be able to demonstrate how to brush their teeth effectively, and discuss ways to improve their own oral health. Surprisingly, oral health is very important. It affects our ability to eat, to smile, to show emotions, to speak, as well as it affects our personal self-esteem, our performance at school and work, different oral diseases, and they can go from cavities to mouth and throat cancer, cause pain and disability for millions of people. Additionally, research has shown that oral health, especially periodontal disease, is linked to several chronic diseases. Some of those are diabetes, heart disease, and strokes. Also, in pregnant women, it's also been shown that poor oral health is related to premature births and low birth weights. So, what makes up the oral cavity? The oral cavity is typically what we call the mouth. It includes your lips, your tongue, the actual cavity inside your mouth, all of the tissue lining the cheeks and the lips, the gums, both the upper and lower, the roof of the mouth, that's like the hard palate, soft palate, and the very small area of gum back there behind the wisdom teeth. Little trivia about teeth. Children have 20 baby teeth. They're 10 on the bottom, 10 on the top. They usually begin teething around 6 months of age and will typically have all 20 teeth by the age of 3. Children will begin to lose their baby teeth at the age of 6. The baby teeth are replaced with adult teeth. This will continue until usually they reach their early teens. Most adults have 32 teeth. Those include 8 incisors, 4 canines, 8 premolars, and 12 molars. It also includes 4 wisdom teeth. So some facts about oral health. Healthy People 2020 has these facts about oral health on their website. For children and adolescents, tooth decay affects more than 1 in 4 U.S. children aged 2 to 5. It affects 1 in 2 U.S. adolescents aged 12 to 14. In adults, 1 in 7 adults aged 35 to 44 has gum disease. After the age of 65, that rate will increase to 1 in 4. Older adults, 1 in 4 of the older adults 65 or older have lost all their teeth. More than 7,800 people, mostly older Americans, die from oral and pharyngeal throat cancers every year. The most common oral health conditions, according to the CDC, are cavities or tooth decay, periodontal or gum disease, and oral cancer. So we'll break those down. Caries or tooth decay is also known as a cavity. It's caused by the breakdown of tooth enamel. Enamel breakdown is caused by the food, the breakdown of food that produce plaque. Plaque is a very sticky, colorless film. When you wake up in the morning and you rub your tongue across your teeth, that kind of fuzzy feeling, that's plaque. It's made from saliva, food, and fluids. They're all combining and they stick to your teeth. Plaque contains bacteria. It attaches itself to the tooth at the gum line and in between your teeth. Surprisingly, dental plaque begins forming on the teeth about 4 to 12 hours after brushing, and that's why it's important to brush very well twice a day and floss daily. Tooth decay and cavities are preventable. Periodontal disease is also known as gum disease. Periodontal disease happens as a result of infections and inflammations around the gums and the bones that surround and support the teeth. In its early stages, periodontal disease is called gingivitis, and as it gets worse and progresses, it's called periodontitis. In gingivitis, the gums are just swollen and red. They may bleed when you brush. But with periodontitis, the gums pull away from the tooth, bone from the jaw is lost, and the teeth can possibly fall out. Periodontal disease is mostly seen in adults. Oral cancer is also known as So what can we do to improve our oral health? You're going to see your dentist regularly, twice a year for a cleaning. Keep your mouth clean. Make sure you're brushing your teeth well every day. Eating a well-balanced diet will improve the health of your teeth and mouth. Check your mouth regularly for signs of gum disease and oral cancer, and avoid all tobacco products. Proper brushing technique. Some tips for proper brushing. You're going to want to brush your teeth twice a day with a soft bristle brush. You can choose the size and the shape based on your mouth and what fits well in your mouth. Replace your toothbrush every 3 to 4 months because the bristles get frayed and worn out and they don't do a good job of cleaning your teeth. Make sure when you're using toothpaste, you use a fluoride toothpaste. Now your brushing technique, according to the American Dental Association, you place your toothbrush at a 45-degree angle to the gums. You gently move the brush back and forth. You brush the outer surfaces, the inner surfaces, and the chewing surfaces of the teeth. And to clean the inside surfaces of the front teeth, tilt the brush up and down and make several up and down strokes. Now, the American Dental Association has a video, and it's actually an instructional video on how to brush your teeth. I've attached the link there below. So we talked about diet affecting the oral health. Some foods that are bad for oral health are lollipops, mints, taffies, caramels, just generally candy. They're bad for your health anyway because they don't have any nutritional value, but they also contain a lot of sugars that stick to your teeth. Sugar-containing drinks like soda, lemonade, juice, and sweet coffee and sweet tea. Drinking those high-sugar drinks causes a constant wash of sugar over those teeth with every drink you take. Oddly, even nutritious foods can be harmful to your teeth due to the acidity in the foods. Some examples of those are tomatoes and citrus fruits. You can still enjoy those kind of foods by just simply eating them during a meal, but not just snacking on them by themselves. Dried fruits like raisins and dried cranberries can also be harmful to the teeth because they're sticky and they adhere to the tooth surface, and the plaque acids are produced and stick to your teeth. Things that are good for your oral health. Foods that are high in calcium. Things like cheese, milk, yogurt, tofu, leafy greens, and almonds. Foods that are rich in protein. Meat, poultry, fish, milk, and eggs. Those are all good. They're also a very good source of phosphorus. And phosphorus and calcium are both very important minerals that protect and rebuild the tooth enamel. Other foods that are good for your oral health, fruits and vegetables. Fruits and vegetables are higher in water and fiber. They balance out the sugars that they contain and will help clean the teeth. They also stimulate saliva production. Saliva is good in that it washes away all the harmful acids in the food particles, as well as it helps neutralize the acid in the mouth. Many of the fruits and vegetables contain vitamin C, which is a very important vitamin for having healthy gums and healing of wounds. It also contains vitamin A, which is another nutrient that's very important in tooth enamel. And of course, water. Water with fluoride is actually the most tooth-friendly drink around. I've listed here my references and where I got all my information. And I'd like to thank you all for watching and hope that you've learned something from this video.